More than 35 years ago, the first cases of HIV were reported. Early on, it became apparent that a response to HIV was necessary locally, nationally, and globally. 3 organizations, HIV Edmonton, the Canadian Association of Nurses in HIV and AIDS Care, and the Grandmothers of Alberta for a New Generation, came together to create a video based on their shared understanding that education is a vital part of the response to HIV. By encouraging dialogue and diverse educational approaches, representatives from each organization created this video to highlight their individual and collective efforts to promote a response to HIV that addresses the inequities, builds solidarity, and creates safe and stigma-free spaces.
I hail from Enoch Cree Nation, which is just on the city limits here of Edmonton. And I've been diagnosed with HIV for 33 years. It was a very challenging time, especially when you're just newly diagnosed.
HIV and AIDS remain one of the world's most significant public health challenges. More than 38 million people are living with HIV and AIDS worldwide. Governments, organizations, and individuals work tirelessly to help provide critical resources to those in need, both locally and internationally. Grandmothers of Alberta for a New Generation, or GANG, has been working alongside the Stephen Lewis Foundation to help provide support and financial aid to grandmothers in sub-Saharan Africa who are raising a generation of children orphaned by HIV and AIDS.
The gang mainly is a group of grandmothers and grandothers who are in the business of raising funds for the African grandmothers who are caring for their AIDS orphan grandchildren. The gang formed in 2006. The International AIDS Conference was in Toronto that summer, and the Stephen Lewis Foundation decided that it would be a good idea to have a grandmothers gathering.
They were having 100 grandmothers come from Africa, and they met with probably about 200 grandmothers from across Canada to hear firsthand the story and the struggles that the grandmothers in Africa were dealing with the AIDS pandemic.
Kwangisiza kakhulu ngoba nosulalela nalo exoxa nalo exoxa awu ngathi inkosi ngiyabonga ukhona ngoba ngabe ngathi inkosi yami kanti akumina ngedwa kanti inkosi namba yengizondi kusiyafana
so it for her she's
moko be kurukwera katatiri ni anyamwere chakaranon nikijana kwero gentito kanutira nikichamwonya ukasamba sakendo kama chielo nikichidi
sabana emhlangano oliviki ezasesicethile basibuta kusiboma ke ngibani ofuna kuphekela labantwana labangakhona ukuthi goga bendele lutho kwabade ngase ngiyaphakamisa manje ke saqala ke kwakunebantwana lesana bo 9 years bangadi kuye esikolweni kodwa ngokufika kwaSapholo kube nelidlala wabakhanza abahleli lapha wababida bababuta ukuthi abayilele esikolweni bachaza kha kubophunyini kwasekuthiwa ngibathathe unobacela indzawo esikolweni.
To have that conference and that gathering and to recognize that the grandmothers, the African grandmothers, were trying to keep their communities and their families together. The main interest for me is in the educational side of things. And we have done a lot of presentations to community groups to really raise awareness of what the situation is like. The whole notion of the AIDS and HIV pandemic seems to be fading into the background, or it's being dismissed as, well, that's over there. It's not part of our life here.
The gang would go into schools. That was very interesting because a lot of us are teachers. We'd go in and read. We'd read a book about an African child or maybe an animal or something that would appeal to the different age groups. And then we would talk about the gang and we'd talk about the Stephen Lewis Foundation.
We do have the grandmother campaign. It's a community that came together to say, we need to stand by the side of our sisters in Africa. That's also our community. The Stephen Lewis Foundation is a community.
My role at the Stephen Lewis Foundation is a Grandmothers Campaign Officer. So that means I work with grandmothers groups across the country and help them in facilitating their fundraising activities. So everything from tech support for online fundraising to sending them materials and giving presentations at their events and anything we can do to support grandmothers groups.
These grandmothers needed money to do various things. It was going to help with education and student uniforms. It was going to help with housing. It was going to help with providing food.
All these things are things we've celebrated over the 15 years, where we see the confidence come back, the communities becoming more healthy. The 15 years that we've seen it with the Stephen Lewis Foundation looks like 50 years to me, because it's a lot that has been achieved in this small period of time that we never expected would be achieved.
I have a lot of confidence that the Stephen Lewis Foundation is going to be around for a very long time, and we're looking at that sort of long-term strategic planning and how can we continue to support our partners and continue to support grandmothers groups and continuing building that momentum. So it's been really inspiring to see, and I think the future is very bright.
Our soul is with the grandmothers of Africa. So until they can be at peace, we can't be at peace because there's so much that needs to be done. And this group of grandmothers are unstoppable.
HIV Edmonton supports people living with and are affected by HIV and AIDS by developing educational resources for community organizations, healthcare professionals, and the general public, developing and delivering prevention, health promotion and support programs, and providing a voice for people living with and affected by HIV and AIDS. The work is done by working with local, provincial, and national organizations on policy development, health strategy, and program design.
HIV Edmonton started off as the AIDS network. There was several people sat around a kitchen table, and at that time, people were dying from AIDS. They really didn't have the proper medication. We used to have 2 breakfasts and 1 lunch a week, and people could gather and hang out and talk. We had sharing circles, we have collective kitchens. We had a lot of activities. So it's just trying to help people in every area of their life to make their life better. There is support. We do have medical stuff if we needed to get supported, counseling or anything like that. I mean, it is tough because you hear a lot of sad things all the time. Like in the last year or 2, we had a lot of community members pass away. All our programs, they have different needs and different things. So we need to look at how we can help everybody.
The Canadian Association of Nurses in HIV and AIDS Care, or CANAC, work across Canada with nurses and other healthcare professionals to advocate for fair, and equitable treatment for people living with HIV and AIDS.
Our first president was, and the person who really led us to organize was Andrew Johnson. So when Andrew Johnson came on the scene, for me, he was a nursing student, a mature nursing student at the University of Toronto, and he was supposed to go to try to get a placement in my clinic, which is what he wanted, my HIV clinic here at Sick Kids Hospital. He was already doing some work in the gay community in Toronto, trying to help as a volunteer with guys who were sick. So he was the one that really, as an organizer, as an amazing kind of leader and bringer together of people, for me was amazing, was finding each other across the country as we came together even the first time when we had our first conference, was that everyone was kind of the same. We felt we could encourage and support each other because really it was the emotional piece we were dealing with, was that people were dying, people were sick, people were scared, people weren't sure how this was transmitted, what was going to happen. I think from the time CANAC began, those of us who got together all faced all the same issues. We struggled to, be there for our patients and not get frustrated with our colleagues in all types of healthcare backgrounds, and to kind of find a way to do that, give that information out. So I think from the start we became educators, even if we hadn't been an educator before that. And we began to branch out right into activism, because activism became part of almost our education of the public by saying, here we are, we're standing here for our patients.
HIV and AIDS, medicines and treatments have made huge strides over the years. However, many individuals living with HIV and AIDS still face stigma and discrimination. HIV Edmonton strives to change the narrative about living with HIV and AIDS, particularly in the fight against HIV-related stigma and discrimination, as well as amplifying the U equals you, undetectable equals untransmittable message by developing strategies to spread community awareness and build trust.
In December of 1989, my GP, my physician, had informed me that I was diagnosed with HIV. He gave me a time frame of 6 months to 10 years. I had to put up with discrimination. I had to put up with racism. All those barriers, and now being diagnosed with HIV, it was another compound.
I had a lot of relationships that turned me down because they found I was HIV. They didn't want to be around me. They didn't want to talk to me. It hurt me big time, I felt it just pushed me right down. Like, I didn't feel like I want to be around alive again.
I was diagnosed with HIV in 2001 and didn't really know what to do. I would have figured for health professionals that it would have been a much more compassionate, much more supportive environment, but it wasn't.
One of the earliest challenges that we encountered in HIV care, HIV nursing, was the amounts of discrimination and stigma in the early phases of HIV.
Historically, it was a very difficult field to work in, right? I mean, it was highly stigmatized, and it wasn't just the patients that were stigmatized, the staff were stigmatized, right?
It happened one time. It was the little nurse warned the older nurse about to put her gloves on because I had HIV on, right? So, and then the older nurse kind of looked at the little younger nurse and said, oh yeah, I know, and then put the nurse on, the gloves on, right?
I mean, it's hard for me to access healthcare sometimes. I've had signs on my door in hospital saying infectious disease, and it's really hard on your self-esteem.
I had one community member that was living in an old folks home, and the cleaners didn't want to clean his house because he had HIV. So we had to go out and educate the staff, the cleaners at that place, to let them know that they're not going to get HIV from cleaning up.
And I just like to say within my story, as a white woman, I do have privilege, And a lot of my friends aren't that lucky. They, being people of color and things like that, they don't have that privilege that I do.
I think there are a lot of societal factors that contribute to and continue to perpetuate some aspects of the stigma and discrimination people living with HIV encounter and continue to navigate.
Discrimination is the intersectionality of discrimination for the color of your skin, and then you add another layer on it. Do you use substances? Are you a trans woman? Are you a person of color? Those layers build, and then it just creates such a target.
It's better to conceptualize HIV as a series of multiple epidemics because it hits and influences different people in different regions from different socioeconomic strata to different geographic locations and different geographic places.
Community connections play a vital role in the lives of those affected by and living with HIV and AIDS. Events, outreach, and support initiatives help to create an environment where individuals not only survive, but thrive. As a champion for health equity, HIV Edmonton reaches out to meet people where they are and where they need the organization. This is done by reaching further into the community, meeting community members according to their needs, and building on its position as a recognized thought leader to shape the modern conversation around HIV, sexually transmitted and bloodborne infections in Edmonton and Alberta.
We try to do a lot of community stuff with people because that's the one thing I find with people with HIV is they need to support a community. It's really, really important because a lot of people tend to just stay at home by themselves and isolate, where here they feel like a family. They feel safe, they don't feel like there's any stigma towards them here, so they can feel comfortable talking to each other about stuff.
The best support I've found is finding community who understands without saying a word. It's just somebody who's been exactly where you are and you don't have to explain anything.
Like all these homeless and all that's living with HIV or don't have HIV, they need a lot of support like me to show them I made it through and I can help them through the same thing, living with HIV.
As nurses, we are the healthcare professionals who provide the most direct care and often the most incredible opportunities for advocacy, not only for, but more importantly with the patient populations that are navigating HIV. I think a lot of times it was through the opportunity to come together and either at local levels have local meetings where we could come together and talk, share experiences that we were navigating, facing together.
We do so much to make sure that our community is okay, is safe. We so care about each other. We are a community, and we were a small community, almost like a village. Now we're maybe a little bit bigger village, and maybe we're almost a town. We're big.
I think the most important thing is that we are resilient. Resilience comes in all walks of life. And if we keep and maintain our solidarity in what we choose to do with no judgment, but to be inclusive in supporting and acknowledging each other, to be able to have faith and become that beacon of hope. Because we're all role models and we're all teachers in life.
GANG, in partnership with the Stephen Lewis Foundation, along with HIV Edmonton and CANAC, continue their work to raise awareness, educate the public, and improve the lives of those living with HIV and AIDS.